Hello, I'm Kelly, an obstetric doctor at Monash Health.
And I'm Tracy, a midwife at Monash Health. Having a baby is a life-changing experience. At Monash Women's, we try to make that experience as positive as possible.
We hope you find this video on labour and birth helpful as you prepare for the experience ahead.
Normal labour and birth is hard work. Preparation and education will help you on your labour journey. You may feel unsure about when you should call or go into hospital, especially if it's your first baby. Sometimes it is difficult to know if labour has really started. The most common signs of labour beginning are: you are feeling contractions that become regular and stronger. You have a show where the mucus plugging your cervix comes away, which might be slightly blood-stained. You have low back pain, or your waters break. It is important that you phone the hospital and speak to a midwife if your contractions are about 5 minutes apart, lasting for about 45 to 60 seconds, or if you are feeling strong contractions prematurely, that is less than 37 weeks. Your waters break. This is particularly important if the liquid is stained brown or green. If you have any vaginal bleeding, that is more than a blood-stained mucus show. Your baby is not moving as much as is normal for your baby, or you have any concerns. The advice the midwife gives you will depend on what you tell her, how far you are from the hospital, your preferences and other factors. When you are advised to come to the hospital, please remember to bring your handheld pregnancy health record with you. If this is your first baby, you can expect that your labour will last around 12 to 14 hours once established. If this is your second or subsequent baby, this time is generally shorter. With all hard physical work, there is some aspect of pain. Normal labour is not like the pain associated with injury. It is your body working hard to birth your baby, and there are many techniques and options available to assist you to relax and work with your contractions. Having encouraging and supportive people around is also very important. At Monash Health, you have several types of medical pain relief available to you, including nitrous oxide or gas, pethidine, which is an injection, and epidural anaesthetic. We have an information fact sheet on the website called Epidurals in Labour, which you can also download and read about in advance.
Most women will have their baby by a vaginal birth. Sometimes it may be necessary to assist the birth of your baby with the use of either forceps or a vacuum. These can only be used when the cervix is fully dilated. The most common reasons for an assisted or instrumental birth is that the baby is not coping with labour, the mother is exhausted, the position of the baby, or an epidural has slowed progress. A ventouse or a vacuum birth is where a suction cup is placed on the baby's head and used to gently pull the baby out whilst you push. A forceps birth involves metal instruments, a bit like spoons, being placed around the baby's head. These are used to gently pull whilst you push too. If you're advised to have a caesarean section, either before labour commences or during labour, this will have been considered to be the safest option for you and for your baby. In most cases, you're awake during a caesarean section birth and you can have one birth partner beside you. You'll be given an anaesthetic so that you don't feel any pain. This may be an epidural, a spinal, or a general anaesthetic. A caesarean is major surgery, and as with any surgery, there is a small chance of medical problems. You will have a longer stay in hospital and your recovery once home will be longer.
It's important to have a wish list and be well prepared for your labour and birth, but understand that the unexpected can always happen, so expect some surprises. In closing, we would like to wish you the best of luck with the upcoming birth of your baby.
Whatever your birth experience, we hope our staff at Monash Health can help you to make it a positive one.